Welcome. So let's study together. Why? Because it's easier and more fun. You'll be more efficient. Repetition is the key, and you'll get some free study notes. Okay, so what to expect here? You're going to have 5 questions per block, simply because I don't want to make these videos too long, so you can do them whenever you get a chance without stopping and then continuing. You can complete the whole video. There's not going to be any computer reading, so you're going to be enjoying my pretty accent simply because I find those computer readings super annoying. There's no any fancy formatting. It's because you're not going to have any on your exam, so just make sure that you get used to this white background. I'm going to give you 5 seconds to pause, read, and answer your questions, but of course you can pause anytime, and you're going to definitely need more than 5 seconds to answer these questions. Then we're going to discuss each answer, correct and incorrect. The explanations are going to be focused just so we don't get too far from the topic. And then you can pause any question that you might have. Okay, I'm going to get to them for sure. Here's your question 1 in 5 seconds. Okay, so let's see what we can diagnose this patient with. So obviously we can see an inflated self-esteem. There's some impulsivity, and there's an increase in goal-directed activity. She's super talkative, and she hasn't slept in several days, okay? So decreased need for sleep, talkative, flight of ideas, increase in goal-directed activity. It's all going to lead us to think about bipolar manic episode, okay? Now, bipolar manic episode is probably part of bipolar disorder, okay, which is marked by episodes of mania, hypomania, and nearly always includes episodes of major depression, which automatically makes choice an incorrect statement. All right. So the drug classes commonly used to treat mania and hypomania include lithium, anticonvulsants, antipsychotics, and benzodiazepines. So sometimes we use them as monotherapy, or sometimes we just combine them. For example, lithium plus an antipsychotic, which basically makes both B and C incorrect. Buspirone is a non-benzodiazepine, non-barbiturate anti-anxiety medication. It's not going to be used in bipolar, okay? Lithium certainly is used in a treatment. However, this is not a personality disorder. That's why this is incorrect. Regarding statement D, it's false as well, because we all know that twin family and adoption studies indicated that bipolar definitely has a significant genetic component. Statistically looking at those, the first-degree relatives of a person with bipolar are approximately 7 times more likely to develop it than the rest of the population. All right, which leaves us with the correct answer, which is E. As we talked about, the treatment and antipsychotic may be used in the treatment of bipolar, either as a monotherapy or in a combination with lithium. Let's get to question number 2. What do we have here? We have a recent linear bruise across the left forearm because she fell off the chair. And there's another big bruise in the small of the back. And there's a poor eye contact of the child. So actually, some of those may lead us to think of the child abuse. And just so you know, we do not have to have a proof before reporting a suspected child abuse. So prompt reporting of suspected child abuse is the appropriate step for us to do. Okay? So there's the next one. Which one to exclude first? Well, let's go with A. Obviously, these are not the common bruises. In fact, with falls, you're going to expect to see bruises to the front of the body or the bony prominences such as knees, shins, and forehead. Not in the small of the back or a linear bruise across the left forearm. Furthermore, we can safely exclude choice B because lack of emotional interaction between a parent and children automatically leads us to a suspicion. Furthermore, with the exception of child sexual abuse, children are most likely to be abused or neglected by parents or caregivers. When it comes to physical abuse, children are actually more abused by the mothers, by approximately 5 to 10%, which makes our choice D incorrect. That leaves us with choice C as the correct answer, since some researches show that babies born premature or a small weight are more likely to be abused or neglected. Okay, off to question number 3. Okay, so what do we have here? We have a patient who's quite young with recurrent syncope. He plays basketball. With recurrent syncope, sudden death in father, and then some issues with mitral valve. So this all should lead us to a possible diagnosis of hypertrophic cardiomyopathy. Okay, it's a genetically determined heart muscle disease, and this is exactly what we're going to see in the patient. Difficulty breathing, shortness of breath, syncope, sometimes palpitations, dizziness, sudden cardiac death. All right, so his father probably died of sudden cardiac death. But this guy is lucky. So in all patients with the suspected HCM, we have to do an ECG and a transthoracic echocardiography, which makes A the incorrect answer. And when it comes to treatment, we're going to use beta blockers with non-dihydropyridine calcium channel blockers, which excludes both of these from the correct answers. We need them to slow down the heart rate and prolong diastole, which is going to help ventricular filling. Okay. Vasodilators and diuretics should be used with caution, or they should be completely avoided, especially if a patient has a significant left ventricular outflow tract obstruction. Therefore, we only have one correct answer here, okay? So patients with HCM may be at increased risk for developing endocarditis, but there are some revisions to guidelines for endocarditis prophylaxis, and nowadays they state that patients with HCM no longer require routine prophylaxis. Therefore, in this patient, the prophylaxis can be safely avoided. Okay, let's memorize this. Okay, actually, please skip this. My slides didn't align properly. So we're going to skip question number 5, come back to it. But let's go to question number 4. Okay, so we have a straightforward question here. All right. Hypertension is the most common cause of intracerebral hemorrhages. The predilection sites for them include the basal ganglia, number 1, and 40 to 50% of these cases are located here. Lobar regions, thalamus, pons, cerebellum, and other brainstem sites are following basal ganglia. Okay, the incidence of intracerebral hemorrhage increases in individuals older than 55 years. It actually doubles with each decade until the age of 80. All right, and here's something to remember as well. For people younger than 45 years, lobar hemorrhages are the most common site of the hemorrhage, and it's frequently associated with the arteriovenous malformations. Okay. All right. Let's go to question number 5. All right, so we have a patient with an obvious knee infection and a high risk for STD. Okay. Septic arthritis due to bacterial infections is commonly classified as either gonococcal or non-gonococcal. But overall, Neisseria gonorrhea remains the most common pathogen among young adults who are sexually active. Actually, 75% of these cases are caused by Neisseria. All right. Another question it could be asked about is just like in this one, okay? So a joint void from the affected knee is performed. What do you see? So it's going to be gram negative Diplococcus. All right? So make sure you memorize those. Salmonella is associated sometimes with prosthetic knee infections and sickle cell disease. Staphylococcus is the cause of the majority of the cases of acute bacteria, but non-gonococcal arthritis in adults and in kids older than 2 years, and also with prosthetic joint infections. Treponema causes syphilis, easy to exclude in this case, and then streptococcus accounts for 20% of cases of septic arthritis, and they're usually found in children. And that should be it. Now let's get to our little summary. And time for screenshots. Here comes the big one. Make sure you know this. Good job, guys. Thank you very much, and let's get to the next block.